Hello there. I'm Matthew Gibson, MD, and I'm a family medicine doctor and psychiatrist at Mercy Methodist in Sacramento, California. And today's my day off, but I'm making this video specifically for the Northridge Family Medicine residents. Hello, guys. I was requested to do a video about de-escalation, and I think primarily for the clinic setting, but the principles kind of apply regardless of where you are. I think first and foremost, de-escalating a tense situation with a patient, but it also applies in other situations as well. First and foremost, I think you have to treat everyone involved like a human being. We get in trouble when we think that we have too many tips and tricks and we just have to follow an algorithm and then everything will just magically fall into place. Not so true, because we're dealing with actual real life human beings. And so anything that I say, you're going to have to make sure that you apply to the actual situation where you're at and treat everyone involved like a human being. Now, that includes yourself as well. That's my first or second point, I guess, is don't ignore the fact that there's tension, that there's conflict, that the patient is irritated or upset or anything. Really, that should be your first priority. Sometimes with doctors, we have a sense of, the visit has to move forward and I just have to keep plowing through. And this applies to other situations as well, not just doctors and patients. We have a relationship or the friendship or whatever. We're just going to ignore the fact that they're upset and just kind of power through and just kind of put our heads down. That's often a trauma response. But treat the upset first. That's going to be your first target. I just like saying things like, it seems like you're upset. And a lot of times you get the no shit Sherlock kind of response, and that's okay, because then you're in the moment, you're talking about it, it's real, right? So you can say, okay, depending on what the situation is, you may ask for more clarifying questions because you don't know why they're upset. You can say, can you tell me about why you're upset? And a lot of times you will know why they're upset. If you're in medicine, it's probably because you're running behind and the patient's upset that you're running behind. Okay, acknowledge whatever your part is up front at first. Start off with that. Say, hey, I'm sorry that I'm late. See if you can move quickly beyond it, but listen to them first. And see if you can address exactly what their complaint is first and foremost. Of course, if they're treating you badly, then you may have to set some boundaries, and maybe that's a part two. For now, so long.